The views and opinions expressed on the Healthcare Advocate Show do not necessarily represent the views and opinions of Connoisseur Media or its advertisers.
Revolution Healthcare Radio is brought to you by Home Helpers of Connecticut, in-home senior care services, and Protein Sciences, the creators of Flu Block, a safer, more effective flu shot.
It's Revolution Healthcare, the show that keeps you in the know about the ever-changing healthcare system. We all need answers to our many questions about health, and the revolution in healthcare, presented by Patient Advocate for You, making sure that your healthcare is coordinated properly. And now, here is Sharon Gauthier, taking your calls and sharing information. 1-888-574-2723. 1-888-574-2723.
Good morning, everybody. It's good to be back to the cold weather of Connecticut. We spent last week down in Florida, and it was nice just to do nothing, but it certainly was an improvement on the weather from Connecticut. Fred did a great job last week, although we had some problems with telephones and numbers for Chris Fay to call in, who is a national driver for change in healthcare along with technology. Fred is actually at a technology conference in California right now, and we'll be back later tomorrow. So I'm very happy this week with the guests that we have. For a very long time in my career, I always wondered why we never really thought much about the families and sometimes the patients themselves, if they were awake and alert about the experience they were going through. And like everything else in healthcare, no one really thinks about doing anything until it hits their pocketbook. I felt that way when it had to do with infections. Infections were a huge problem for a number of years, and until the state mandated to track them, address them, and Medicare said, we're not going to pay you for an infection that starts when someone's hospitalized. No one really developed aggressive protocols to manage that. And then fast forward, we had issues with readmissions. Same thing. People were readmitted continuously. They didn't stay in the hospital very long. It was really about utilization review, and which means that the utilization of funds that were given to hospitals by insurance companies had to be utilized well and efficiently. That often had people who left the hospital too early, and they would come back the following week with the same problem, and they would always get paid for it. So, again, there was no aggressive system put in place to try to address that until it hit their pocketbooks. Excuse me. And then Medicare said, wait a minute, we keep paying and paying for the same problem here, so we're not going to pay you anymore. And suddenly they developed accountable care organizations, took advantage of funding that was available for that, and we're still in the same place as far as I'm concerned. We work on a daily basis with systems that continue to fail our patients. The patient experience, the only reason at this point that hospitals are even remotely interested in what the patient experience is because, once again, Medicare is coming back and saying, we're going to pay you for a good experience that patient and family has through your system. So now everybody's scrambling to make sure that we please that family and we please that patient, but are they continuing to look at outcomes at the end of all that? Or are they more worried about being nice to everyone because it's going to affect the bottom line? So again, not a proactive approach to healthcare at all. And this week, I'm very happy to have two guests. One is Randi Oster. She's going to be calling in. And Randi and I actually met by accident on LinkedIn when my niece, Sarah Gauthier, who is a copyright and lives in Fairfield, and just to plug her Gorganics that she has developed, she had asked me on LinkedIn and introduced me to Randi. And Randi is an engineer and very bright, lives in the Fairfield area, has a son at the time who was 15 years old who was diagnosed with Crohn's. And that really hit home with me because my husband has had Crohn's for as long as I've known him, which is 50 years, and has had a lot of struggles with it, multiple surgeries. And I certainly understood the angst related to that when she developed the book. So belonging to Metro Hartford Alliance, she did come initially when the book was released to talk about her experience as a family and how the system really leaves out what is going on with the family. Sometimes they take great care of the patient, sometimes they don't. Having had a husband that was hospitalized for a 5-month period a number of years ago, and my working full-time, having 2 teenage children that I'm sure I still don't know some of the things that went on with them, managing a mother with dementia, on a husband who was very, very ill in the hospital. No one at that time ever asked me how I was doing. Never. And it did impact us. It impacted my children emotionally. I think my daughter is still somewhat harmed by that, and that was 25 years ago. So Randi is going to talk a little bit about the book that she wrote, which is Questioning Protocol. And as you know, questioning anyone in the healthcare system for years was always not something you would do. And I always questioned and always got in trouble for it. I think there's still some retaliatory things that happen when you dare question someone. I still have clients. I spoke to a friend of mine in Florida who was very involved with the Patient Advocate Institute, and she was diagnosed with a brain tumor last year and was very fortunate to have several of her peers around her who were active patient advocates. And she was telling me how the physician was extremely angry at her, that she even remotely thought that she needed to have someone in the room with her with having a brain tumor and not having the ability to really understand some of what he was telling her. So I think there's still some resistance to that. So Randi's going to be calling in. And the other person that I have here is Catherine Crockett. Good morning, Catherine.
Hi.
You can come a little bit closer. Catherine had a hard time finding our building today, but I so appreciate your coming. So Catherine and I actually met on Facebook. Faced In, boy, that'd be a great show, wouldn't it?
Yes.
Faced In. We actually met on Facebook a number of years ago, I think, when you were struggling with some issues with her mom. And whenever I see any of my Facebook friends, and I have several thousand of them, but especially ones that are close by struggling, I always offer my help in some way, and had reached out to her to see if there was some way I could help. Hopefully at some point I did have some help, but she's going to talk a little bit about also the issues involved with your mom and how difficult that was, and not really related to caregivers, Catherine, because it sounds like your mom had some pretty significant caring people around her.
I tried my best to create a team of people that really helped me, but it was really hard. My story really is about the struggles of being a single person caregiver, not having family around to support me and help me through the process. And I really had to wear all the hats of dealing with the finances, the medical world, her care, my emotional care, and the struggle with how do you make a living as a single person without a spouse, without family support? How do you make a living and care for someone at the same time? And that's what really took me down financially, was trying to give my mother the kind of care that I felt like she deserved at the end of her life.
Catherine, tell us a little bit about what you do, your background.
I've had many lives, and I've been through many caregiver situations. My sister has multiple sclerosis. My ex-husband had multiple sclerosis. And then about 7 years ago, when my dad failed, I had to then go into caring for my parents. And
is it just you?
Yeah, because my sister has MS.
Correct.
She's actually confined to a bed right now. Her husband's her full-time caregiver, so I live in the world of people who
caregiving.
are struggling with all the different aspects of caregiving.
We had Nora Duncan on a few weeks back, who is from AARP. She's one of the directors. And there's a huge focus on caregivers right now. And again, it's kind of odd to me that we're suddenly thinking about caregivers because they've existed for a number of years. Family units for years have always taken care of their loved ones, but as family units have broken up into a different kind of family unit in today's world, where people are living longer, which means their family members are usually working longer and not necessarily in the area. You were fortunate enough to at least be in town or around her, but you're right. You know, you're trying to make a living and still dealing with the phone calls and the decisions that are being made and the continuity and what to do. And she was living at home for a while, right?
Yes, and I actually was not in the area. I was living in Massachusetts.
Oh, you were?
And I was living on Martha's Vineyard for a while and had to move back to the mainland. So anyway, I moved here 3 years ago when it got too much going back and forth. And I realized with her dementia, I had to get her out of her house.
So you've moved out of state to be close to her, which meant whatever business you had, you also had to bring with you. Now, we're going to come back after a brief, I don't know, what do we call it? I suppose our supporters, our wonderful sponsorships. We are going to have a sponsorship report shortly. And when I just want to give that number out for everyone to call. Our number here is 888-574-2723. We're talking to Catherine Crockett, who is someone I met on Facebook and asked her if she would come on and share her story. And when we come back, we'll also bring in an award-winning book writer who is Randi Oster, and her book is called Questioning Protocol, and we're going to talk to her when she calls in about what went on with her son. So thank you for listening, and we'll be back shortly.
Uh-oh, flu season again. Time to get a flu shot. You now have a choice in flu vaccines. You can ask for Flu Block.
It is the healthy individuals that carry and spread the flu. Every year, about 30,000 Americans will die as a result of the complications of influenza.
It's one of the reasons why I had an interest in it is that our population, that our service tends to manage our elderly. People were having to get a booster with the flu vaccine. What I liked about Flu Block is that the people last year in our group, the clients of ours that got the flu vaccine, did not get a booster and they did not get the flu. And the people that didn't get the flu block vaccine either got the flu in addition to getting the vaccine or were told by their physicians that now we had to try to create a process for them to get a second vaccine.
The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
Home Helpers is a franchise in Connecticut, and what I was impressed with Home Helpers is their passion for what they're doing. We work with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Welcome back, everybody. You're listening to Revolution Healthcare Radio. This is Sharon Gauthier. I'm a registered nurse. I believe that I'm an expert navigator of the healthcare system. I'm very fortunate today to have with us Catherine Crockett, who is someone that I actually just met on Facebook a few years ago and kind of followed her life. So, Catherine, before we left for a brief moment, you were talking about how you actually moved from Massachusetts to be closer to your mom, and she was living at home at the time, correct?
Correct. She was in a house where she had lived for over 50 years.
Very common story we get.
Yes. And my dad died 7 years ago, and I went through, the end of my dad's life. We actually brought him home to the house, and he died at home with hospice care. And at that time, we began to realize how serious my mother's dementia was.
Mm-hmm.
So when my dad passed away, I had to start keeping an eye on Mom and going back and forth, and she had a great neighbor who really kept an eye on her. Thank goodness for neighbors.
Yes.
A lot of times they play a big part in helping support people in their elder years when they're still at home. But as time went on, I realized that the house was not in great shape. We did not have the wherewithal to do the work on the house that needed to be done to keep her safe. She was starting to wander out onto the streets, picking up sticks.
Yeah.
All these things.
All familiar stories to us.
And so at that time, I decided I had to move her into an assisted living environment where she would be better kept, better contained, safer, and be able to get her meals, and rather than bringing people
and have someone there
house.
most of the time.
Yeah.
We're going to bring on Randi. Randi Oster has called in, and we're going to bring her into this conversation, Catherine, and I'll introduce you to Randi. Hi, Randi. How are you?
I'm great. I'm happy to be here.
Thanks, Randi. So we've been talking to Catherine. Catherine Crockett, this is Randi Oster. Randi, this is Catherine.
I'm excited to meet you, Randi. I've read a lot about you, and I'm looking forward to reading your book. It sounds great.
Oh, wonderful. Likewise, I've heard a lot about you as well.
So, Randi, I was telling our listeners, and again, if anybody would like to call in to ask questions or tell their stories, our number is 888-574-2723. I was telling folks about how you and I kind of met through LinkedIn with my niece, Sarah Gauthier, who is a copyright, but then went off and did her thing with the salsa, which is organic, so I'm kind of plugging her salsa now, and then kind of followed you with your story. And for me, it really hit home because my husband's been diagnosed many years ago with Crohn's disease, and certainly understood the plight for that. So if you can talk a little bit as a regular person, not in healthcare, as Catherine, who was thrown into this whole situation with your 15-year-old son, questioning protocol, I think is just such an ideal name for your book because so few people feel comfortable doing that, and how you were able to come to a place that your son is healthy and managing with his disease well, but as you and I talked yesterday, how this truly affected the family, and there was no one there to really ask, how are you doing?
Mm-hmm. Gladly. Would you like me to start now?
Absolutely. You have the floor.
Wonderful. Well, I'm like so many of your listeners. I'm a mom, I'm a wife, and I'm a daughter. And I am sandwiched, and in addition to all of this, I also have to make a living. And even with elder care, taking care of my mom, my husband has a pre-existing condition, and then my son got diagnosed with Crohn's disease and ended up in the hospital. My life felt like a house of cards that just with a little, the whole thing was going to come crashing. And how was I supposed to balance all of this? And at the same time, when we're looking at our loved ones that are sick, they're in pain, you're scared. Even when we don't have health crises, it becomes hard to manage our lives. And at that point in time, when you're thrust into the healthcare system, what I really wanted was to be able to trust. I really just wanted that they would take care. And what the lesson that I learned was you really need to question. So while I wanted a hug, I had to be even more on my game. And I still then had to manage taking care of my elderly mom, making sure that my husband was okay, and I have another son as well. And so there were some real good techniques that I learned that I hope to share today that helped me keep that house of cards from falling down.
And Catherine actually was just discussing the same thing. Catherine's situation was a little different in that she was all by herself because her sister has MS, her ex-husband had MS, and now her mother is alone because her father passed away. What did your father pass away with?
He had some diabetes issues, heart issues. He had congestive heart failure, but he was also starting to show the signs of dementia, which you don't realize right away. And it's really, really important for families as their parents get older to spend time with them longer than just a quick visit to really see what's going on with
And
the family.
we see that all the time, Catherine, that families will say, I'm just really surprised, everything was fine. And everything's fine till it's not fine anymore. So as with Randi, you were like thrown into this situation of now your dad's passed away, there are no other siblings, you have a life, you need to make an income, and you're living out of state. And as Randi talked about, how do you manage that? How was it for the both of you to kind of women in general don't tend to take care of themselves. It's unfortunate, I was in my 50s and 60s before I realized that was an important thing, because we're just not brought up that way, and especially if we are a natural caregiver, which many women tend to be. So, you and Randi can talk a little bit about how damaging that was, and how did you resolve that?
So the key for me when I went through this was realizing that if I fell apart, the house would fall down. And that was so scary, because who do you turn to? The people you typically turn to are the people who need you the most. And I had to discover that, many times we can reach out to our girlfriends, or, we start to reach out to other family members. But when it's a chronic case, when we're not talking about something that's going to take 5 minutes or a month, right? When you have an elder care situation.
And they have their own lives, right?
And they have their own lives. And so it becomes, how do we, especially when we're so used to being strong, how do we say, help, help?
Right.
And then who do you reach out to? And one of the things that I did is I said, I would literally ask people, saying, you know what, I need a little bit of help right now. Do you have capacity? Can you listen to me? Is this a good time in your life? And what I found were people were pretty honest. You would get a sense. And what I also discovered is that when things were starting to calm down, I would actually put even more effort into saying to other people, I have a little capacity. I can actually, bring over a dinner. I know that your husband just had his hip replaced.
Right.
And but I think the important thing was the acknowledgement. If life is a roller coaster, when you're at that down point, it's okay to say it, and then to say, how do I help turn this around? And understand that sometimes turning it around doesn't mean everything will be rosy, right? If you have a parent with Alzheimer's or dementia or Parkinson's, or, it doesn't get better, but it's how do I cope in my new reality? And I think that acceptance helped me not collapse and feel sorry for myself, but say, okay, how do I turn this around? And that seemed to work.
And I do believe your friendships are very important. Catherine, how about you? What was it like, especially being by yourself, but you certainly had, a circle of friends, but you find out quick that sometimes that's not going to be a long-term solution, right?
Exactly. It's just like, when your parent passes away, like all of a sudden all your friends show up,
right,
and they want to be there for you, but they're not there before and after. They're there for that moment. Everybody seems to know how to be really compassionate and supportive on the death.
Right.
But before and after, you're kind of left alone again. And for me, moving here from Massachusetts, I left my circle of friends behind. So they were great, supporting me by phone and talking to them, but they couldn't really be here for me. So that's how it became so difficult financially, because I had to hire people to help me with my mom and to help me with the finances and everything that I had to deal with, because my mother could no longer manage, and she hadn't really managed her life before that. My dad had managed so much of her life.
And very common also.
Yes.
So now you're left with her bills and knowing what she paid, what she didn't pay, a household to manage, finding an apartment to live in. Did you did you move in with her for a while? Was that part of the process coming from Massachusetts?
Yes, I was staying with her when I came down here. But when I decided to move to the area was when I had decided to move her out of the house. And I knew that in order for me to empty a house of 50 years of
Stuff.
paraphernalia, and they never threw anything out.
Yeah.
And I had to be here. You know, I couldn't move her to where I was because I would have still had to come back and spend all this time emptying the house. So I moved her to an assisted living nearby and spent the next 8 months here in Connecticut emptying her house and getting her
Which in itself
settled.
is a sad thing. You know, people don't understand that. You know, when my mom passed away, she was down in Florida, and it was very quick and unexpected. I can remember going down there and getting the box of her stuff and having it delivered, and it never hit me until it was delivered as I was looking through these memories and these pictures, some pictures that I've never seen. So I think that, again, caregivers, Randi, is such a part of what your book was about, and I think that you bring in your book some relief as to how to manage that. So circle of friends is important, but I think women in general to just decide to take care of themselves is a difficult decision to make. Don't you think, ladies?
I want to say yes.
Yes.
And I had to learn that I deserve to take care of myself, that it is okay to say, I'm going to take a moment and really enjoy this cup of tea, right? I need to take a hot bath, okay? So, and those are very isolating kind of times. Think about, just that quiet moment. But if I didn't take that time and even acknowledge that I didn't like what was happening around me, right? I was just going to be busy doing a lot of actions and creating this fervor and franticness that's not calming. And I had to find a way to calm myself. And when I did that, and then you reach out to your friends, it's easier for them also to listen. But we have to give ourselves the permission to say, as I'm helping everyone else, I'm going to help myself. And decide what that is. It could be coloring. It could be...
It's funny you should say that. My daughter, who suffers from some anxiety, started coloring as an adult. I know, Catherine, you're very involved with yoga.
Yes.
So that was a big relief for you also.
Fortunately, before my dad passed away, I had gotten into teaching yoga, and while I was driving back and forth to Connecticut, I did an online training to become a health coach. So I have been studying and training in a field
to help other people.
Helps other people, and hopefully has helped me through this process. I don't know what I would have done without the yoga.
We're going to be leaving shortly for a quick break. We're now talking to Randi Oster, who is the author of Questioning Protocol. We'll also talk about her new website, Help Me Health. And we're also talking to Miss Crockett, so Catherine Crockett. So please come back and listen to us, and we'll be back talking to both these ladies. Home Helpers is a franchise in Connecticut, and what I was impressed with Home Helpers is their passion for what they're doing. We work with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
You now have a choice in flu vaccines. You can ask for Flu Block. No actual flu virus is used to make Flu Block. Flu Block protects against the flu. No gluten, no latex, no eggs, no antibiotics, or no formaldehyde. Flu Block is proven to provide broad protection against multiple strains of the flu. The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
Welcome back, everyone. You're listening to Revolution Healthcare Radio. This is Sharon Gauthier. We're very honored this morning to speak to Randi Oster. who is a multi-award-winning author of Questioning Protocol, which helps patients navigate the healthcare system and medical professionals understand the patient perspective. I did speak a little bit, Randy, before you came on about how no one really thought about the patient experience at all until now. Again, it's a revenue source for hospitals to get for the patient experience. So everyone is kind of rambling around trying to find a way to please people, but still not doing it in a way that the outcomes are looked at. And we also have Catherine Crockett here who's talking about her story related to her parents. I wanted to just also reach out to Dot. Dot is one of our faithful listeners. She's in her 80s, and she has no family, and she called in wanting information. Dot, if you can hear us, I want you to call in because we are offering Dot a Thanksgiving dinner for next week because we understand that she doesn't have any family around, and we'd like to provide that for her. So, Dot, give us a ring. Our number is 888-574-2723. So, Randy, as Catherine talks about her way of managing now, she's in yoga, which is a very good self-healing, right, process of finding some peace in your life. It sounds as though that kind of brought you to a better place and now developing a business around it, right?
Right. And, you know, there's so much that we go through in life, and by the time you get to be my age, I'm in my 60s now, I want to contribute back. And I keep thinking, like, how can I help other people, other families move through this process? Because there was no one there to guide me. And when you try to reach out for help in the healthcare community, everybody has their own piece that they do.
I call it checking the box. Everyone has their box to check. When I used to belong, or I still am, on the Dream Team at UConn, which is a group of people they developed because they didn't have a large enough population to have an accountable care organization, which the requirement of that was to have a population of 5,000 or more Medicare patients. And I remember after a year or so, and the whole purpose of the team was to bring people in from the community and everyone and anyone who may remotely be involved with any of their patients that came in to make sure that readmissions were decreased. Well, what happened is that their numbers got better. So they were patting themselves on the back. Great team of people at UConn. I do respect them and for what they do. The people in the audience who were part of this team came from convalescent homes, VNAs. A lot of people were striving to get business also. But this was my issue. They came back after a year or so and said, for their box, which is UConn's box, our readmissions have been decreased greatly. So I'm not sure that they were penalized like other hospitals were. If they were, it was a lesser amount. They were really happy that their box was checked, that they had a decrease in their readmissions. My question then, which created a lot of anxiety and anger amongst the group, was, well, what's happening to these people? Because if, in fact, there's that 30-day window that we don't want them back, and you think about how that system works now, they're now going out home, they're now going out to convalescent homes, rehab, and they're very clear, those entities, that they had better not send those people back within 30 days because they're going to be penalized also. It's a system-wide penalizing system. So, and they also want that business, right? They don't want to annoy the hospital and send them back and then have the hospital say, oh, wait a minute, you know, ABC Convalescent Home seems to send a lot of people back to us. So my question to them was, what happens to those people? Are they dying? We now have them managing critical situations, perhaps, because people are in the hospital for short period of time that are now going to the long-term care, short-term care facilities, sometimes at 11, 12 o'clock at night, 2 in the morning, without proper documentation, without medications for them, with a staff model that hasn't changed, mostly LPNs, which is a different role than a registered nurse. So now they're managing their acute issues. So if they're not coming back in 30 days, are they coming back on day 32, I had said? And now their admission is a $500,000 admission because now they're in the ICU. Or are they dying? Or, you know, what's going on? And I got a lot of hate mail after that from people saying, you're saying that we're not doing a great job. It's like, no, I'm asking the question, what is going on with those people, which we still don't know. I went to Qualidyne. Tim Elwell, he's the CEO of Qualidyne, really nice guy. They do a lot with Medicare, and said to him, I think we need to start looking at that because I, quite frankly, want to know about all the boxes that are checked. So you're absolutely right. When you talk about their box got checked, but they don't know about the other box that didn't get checked, and what did that create for you, Catherine, at the end of all that?
Well, unless there's a me in the picture, I don't know. It's just sad what happens to people who have to maneuver through this system. And for me, I had to be, it's like every morning for 7 years, I woke up thinking, what does my mom need today? What do I have to do to make sure the quality of her life is the way she deserves to have it at the end of the life? Even though she was in a very good assisted living. Absolutely. Because the one failing I see in the assisted living environment is when somebody does need more personal individual care because of dementia or their limitations, the aides that are in these places are handling like as many as 14 or 15 different patients, and they can't give that one person the really kind and quality care that a human being deserves.
And Randi, you and I talked yesterday a little bit about this whole forgetting the family thing, and you talked about the surgery and how that was delayed. So can you tell that story again? Because, again, I think that reveals to us how the system has their little box they check in their own little life, and they don't think about what the impact it has on the family.
So one of the things, and then you've talked about so eloquently, is, we've talked about process versus outcome measures. And when we're looking at the box, right, everyone's looking at their process measures. Okay, did I get this done? Do I know the name of every single person that I'm supposed to care for? Do they have a name tag on? But what you're talking about and what is important to us is the outcome measures. How does that person feel? How healthy are they? Are we getting them at the right stage of, or are we, as you said, making them come back day 32? And what happens is when you look at things from the outcome, from the patient perspective, I believe that will change even what you're measuring from a process. So a quick example is my son was supposed to have surgery on a Monday. Oh. My husband, who had just started a brand new job, he took off because he wanted to be there for his son. And he came at 8 o'clock in the morning, and we wait all day. And at 5 p.m., they said, you know what, we're not going to do the surgery today. Come back. We'll do it tomorrow. Well, that meant my husband had to come back the next day, and of course he did, right? Of course he took off the next day from work. But what was so interesting to us, again, when you're looking at outcomes and you're looking at the family perspective, there was not even an acknowledgement there that this man was now coming back, 2 days in a row and saying, it's really great to see you here. We really, know that family support makes a difference. None of those words happened. And so what happens is my husband's like, did they know at 10 in the morning that they weren't going to do the surgery and they just forgot to tell us? Right? And so when you look at patient satisfaction, and one of the criteria that they're being measured on is communication with the patient. There's also communication with the families. And I think as we're talking about looking at the healthcare system from the patient perspective, and then as we're seeing in this conversation, the family dynamic, because we are there supporting our loved ones and uprooting our whole lives. I think if eventually we can look at it more from a comprehensive patient and family and loved one perspective, we're going to see outcomes improve, because we know that when people feel cared for, that actually helps them feel better.
Absolutely. And I think back, Randi and Catherine, when my husband was hospitalized for 5 months with in today's world would probably never happen. It was back in the 90s. But, my life was in a shambles. I was running around. I was actually in nursing school full-time because I went later in life. I actually was switching my hours, days, nights, had 2 teenage children, a mother with dementia around the corner, just manipulating everything. And not once in that time did they ask me how I was doing. And it was so important for me in the morning to go in and see my husband and give him a hug and sit next to him and say, how are you doing? How was your night last night? And that honestly, in both of us looking back at his healing process, was really important for him to get better. I had to be there for him, and I don't think he really knew then. I think he recognized it certainly later, because we both contribute a lot to our relationship after 46 years, that was important, and nobody recognized that I needed to be taking care of myself. And sometimes it could be a simple thing. It could have been someone saying to your family, we really apologize for this. We know it's an inconvenience. What can we do? Ask people, what can we do to help you? And sometimes you might say nothing, and other times you might say, I remember one time saying, you know what? I rushed over here. My husband has to go to surgery. My kids are home by themselves. I have nothing to eat. I had no money with me. That was not a time of ATM cards. And I remember asking, could I have, a pass to get something to eat? It was that simple. So, now we're in a world of trying to make everyone happy, but I just wonder what that means at the end of the day to the system. Our number is 888-574-2723. Please call in and ask your questions about this. We're talking to Randi Oster. And Randi, you actually had a career before doing all of this. Tell us a little bit about what your career was.
So I actually have an electrical engineering degree. I started out in aerospace working on designing parts for aircraft engines. And what was so fascinating to me was one thing we learned about when you work on aircraft engines is safety.
Right.
You don't want the planes falling out of the sky.
You got it.
And then when I did well in commercial aircraft, I actually got promoted to work on some top secret programs. And even when I worked on the top secret programs, the secret to success and delivering complex systems was communication.
Mm-hmm.
So what happened to me when my son was hospitalized, within the first 5 minutes of being in the hospital with him, I noticed processes. It's in my DNA,
right?
And I'm noticing what's going on here, and I literally had this thought. I said, wow, if we design the aircraft engines the way I see what's going on here with all the spinning of all these people and the fact that I'm repeating myself and I don't think this one's talking to that one.
Exactly.
I actually thought planes would fall out of the sky. I said, we couldn't do this.
Correct.
And so what happened to me is there were so many little things I said, wow, we can really improve this. And when I talk about improving it, making the jobs better for the nurses and the doctors, there's a lot of rework going on. There's a lot of processes that we can streamline. And so what happened to me was I'm sitting there, my kid's in pain. I have nothing to do except maybe sometimes give him an ice chip and maybe hold his hand. And I started writing down what I thought were process improvements.
And I might say that hospitals love it when you come in and write things down. They get very nervous from the onset. It's like, what are you writing down?
So let me just share one of the things on how I built a high-performing team. So you know what I started to do? And people have written to me and said they now do this. I didn't know who was who. Like, people are coming in, and I couldn't tell a CNA from the nurse, from the doctor, okay? And it wasn't clear to me who was responsible for what. And some people, everyone was looking, as you talk about, their little piece.
Yep.
So I took a piece of paper, put it right in the front when they would come in, and I had name, job. Okay, what's your name and what's your job? And then, based on the interaction I had with them, I'd give them a star or not a star.
I love that.
Wait. And I told them everyone who does a good job would get a star, and I would write a letter to the CEO thanking them when Gary got out. Here's what happens, right? Everyone wants to get their name on with a star.
No matter how old you are.
Oh, my goodness. Even the residents, I remember in the morning, the residents would come on. We had to work a little bit with them on the waking us up and the throwing on the lights. And they were saying, how come we're not getting stars? I'm like, because I'm not convinced waking us up in this process is really good for the patient.
I love it.
And what happened was I would see them at the end. They were coming in with flashlights because they knew that I didn't like them turning on the fluorescence, so aggressively. And I noticed that the flashlight would go right by the piece of paper to see if they made the list. And I did write the letter to the CEO. I did each person who made the list. I wrote the letter, and it was right around Christmas, November, this time of year. And what I didn't know was 3 weeks later, my son was re-hospitalized for complications from the first surgery.
Mm-hmm.
Because I wrote the letter, when we came back the second time, they all knew it because the CEO had read it out loud at a staff meeting to all the employees. And what that did is it helped me build that high-performing team. And so when you talk about they don't like you writing things down, I think the advantage of that for us as patients is, and loved ones, the loved ones caring, is that they see us involved in the game. And I want to share with your listeners, I definitely would write down people's names just so you know who they are. I also am going to urge them to write down medications. I want them to say, what's the medication, what's the dosage, what's the time that it's supposed to be delivered, because if they see that you're starting to track this, it's not punitive. We want to be helpful.
Correct. We find the same thing also, Randy, is that when we do ask the questions, and it does depend on how you ask it, but you're right. I love the star thing. What about you, Catherine?
Yeah, that's a great idea. I mean, for me, not knowing, when you come into this situation and you're frustrated, and you don't know what the system is. You're like a fish out of water. You're in a system that you don't know how to maneuver in.
Well, and you don't know what to ask. So when you talk about questioning protocol, you don't know what you don't know.
And so there's a term out there in the elder care world, in the caregiving world, called difficult daughter.
Yes.
And I have frequently been referred to as the difficult daughter because I cared, because I wanted to be involved, because I wanted things to be better. So for what Randy's talking about would be so helpful to give us tools to know what's a more positive way to deal with a very frustrating system at a time when you're at your worst.
Right, and I would often remind people that I was a manager in Hartford Hospital's ER, wonderful ER. I would certainly recommend anyone going that actually needs to go. But I would often remind my staff that complaints that we got had little to do with the technology that they were all so well versed on. It really had to do with those human factors of eating and, having a warm blanket and needing to go to the bathroom. So we're going to take a short break and come back and talk to Randi Oster, who's the co-founder and president about Help Me Health. She's going to talk a little bit about that. And also Catherine Crockett, who has so eloquently agreed to tell her story. And you can call us at 888-574-2723, and we'll be back shortly.
For over a decade, Home Helpers has been making life easier for those in need.
I was very impressed when we first met. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. We actually had a good experience having a home health aide come in and give us respite to make it as comfortable as possible, keep them in control, keep them at home, which was very, very important to my family. Home Helpers share that same vision. We picked Home Helpers because they're extremely strict about the quality of care, the training of the caregivers, They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
You now have a choice in flu vaccines. You can ask for Flu Block. No actual flu virus is used to make Flu Block. Flu Block protects against the flu. No gluten, no latex, no eggs, no antibiotics, or no formaldehyde. Flu Block is proven to provide broad protection against multiple strains of the flu. The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
Welcome back, everybody. You're listening to Revolution Healthcare Radio. This is Sharon Gauthier. I am your host. I am a registered nurse. We have a care management company called Patient Advocate for You. We actually are very fortunate today to have Randi Oster, who is the author of Questioning Protocol. And we have Catherine Crockett, who is someone talking about the experience with her mother and Randi with her son. We actually have Sally from Simsbury. We're trying to figure out if we can get all the callers on at the same time. Sally, are you there?
Yes, hello.
Hi, Sally. How are you?
Good. I just wanted to make a quick comment. I've been listening for the entire hour, and I just, think that the point is well taken that the healthcare providers, many times, if they could just take a minute and acknowledge that the caregiver, of what the caregiver does, and that the caregiver is concerned, and just kind of notice, and maybe ask a question like, do you need a meal ticket, or whatever it might be, if they're really having a stressed out time, or even just giving some direction to them as to something they could do to help, or some way they could maybe relieve some of their own stress. Because oftentimes they really are forgotten about, and they're constantly there. They have a lot of anxiety just because of all that they're dealing with the hospital and what's going on with their loved one. And sometimes just having someone say, we know you're here, and how are you doing?
Exactly. And that's real. It's not any more complicated than that, everyone. It's really sitting down and caring. When I taught at St. Joe's briefly for in the nursing program, we actually talked about sitting down and talking to their patients. So I would say to each of my students, by the end of the shift, I want to make sure that you sit down, sit in a chair, and actually talk to the patient and ask them how they're doing. It could be 2 minutes. And guaranteed, if I went back, they would think they spent an hour with them, because no one does that. There's an ER doctor at Hartford Hospital, Cindy. Hello, Cindy, if you're listening to me, who is awesome. And there was never a moment with any patient that she saw in a very busy ER that she did not close the door and sit down and talk with her patients. And for that, everyone really appreciates that. Well, we have another caller coming in, Sally, but thank you so much for being our listener, and we appreciate your comment.
Thanks for your show. It's great.
Okay, thank you. Randi, are you back?
I'm here.
Yeah, I guess we haven't figured out how to put 3 people. It's going to be Christian's mission next week, our producer. So, Randi, we were talking about, taking care of the caregiver and the importance of tracking. It's funny you should talk about writing names down. Many years ago when I worked on a surgical floor, I almost got fired for doing that kind of thing, because what I noticed on the surgical floor was that residents were going from room to room to room, and they weren't washing their hands. And it really bugged me. And that was a time that you absolutely never confronted the residents and physicians about doing anything as a nurse, because you were low man on the totem pole. So what I would do with my patients is I would give them a pad, and I would say to each one of them, when the doctors come in here, have them sign who they are and what they do, and also ask them if they would wash their hands. I would, or if they did. I can tell you within a week, I was brought into a room with human resources, which is never a good thing, the director of the department, the chief resident, and my manager, and scolded for doing this. And what the chief resident said to me was, you're insinuating that we're not washing our hands, and you're to stop. And I just looked at him and said, I continually wonder why, when there's a problem brought up on the unit, that we become the problem when we bring it. So being the rebel that I am, I just said, no, I'm going to continue doing that. And if you want to fire me, that's fine. But at the end of the day, they do have a right to ask you if you're washing their hands, because you're not. I see it every single day. You know, fast forward to when I was teaching, I would tell that story because now you walk in and you see signs everywhere. But you know what, Randy? I didn't have the stars. So I think that was the key, is having the stars. So we're continuing again to talk about caregivers. Our number here is 888-574-2723. We only have about 4 minutes left to our show. Randy, I definitely wanted you to talk a little bit about Help Me Health, which is the website that you developed for people.
Yeah, so one of the things that I did, as I said, we'll write the book, Questioning Protocol, which gives the tips and the tools and the techniques for consumers to really get engaged. But then I said, how do I take this to the next level and change the system, transform the healthcare system to understand the patient perspective? And that's what Help Me Health is. It's out there for the healthcare community to understand the patient perspective, the patient journey, and then we help them understand what the emotional needs are of patients and loved ones to improve their processes and their ways that they're working. And I will share with you, there were 3 things that our research showed patients want. And I'll tell you the secret sauce, because if anyone's listening, go implement it. And here's the first thing patients want. They want to feel knowledgeable. Yeah, they want to understand what's going on. But the second one is what we've talked so much about today. They want to feel supported. Supported is beyond what happens in the OR, in the hospital. It's how do I pay for this?
And Randy, not to interrupt you, but we have about 30 seconds left or less. I just wanted to give your website, which is helpmehealth.com, and thank everybody for coming on the show. We definitely need to do this once again. My apologies for cutting you off, but next week we have Chris Fay on our show. Everyone, thank you for listening to Revolution Healthcare Radio. And Randy, I'll give you a ring and we'll catch up and let's have coffee. Thank you very much, Catherine, for coming to the show. Take care, everybody. We'll see you next week with Chris Fay.
Coming soon, the Revolution Healthcare Podcast. The people who never talk and the stories that don't exist. The podcast is a more intimate, in-depth examination of the personal challenges caused by healthcare. The focus is on the human aspect of healthcare, from patients and families to doctors and nurses. They all have a story that needs to be heard. The Revolution Healthcare Podcast is available early January 2016. Thank you for listening to Revolution Healthcare Radio. Want to learn more about the show? Visit revolutionhealthcareradio.com. You can also access old shows, learn more about our guests, and contact us with your questions. Revolution Healthcare Radio, brought to you by Home Helpers of Connecticut and Protein Sciences, the creators of Connecticut, 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 and Protein